Okay. All right, you guys. I'm so sorry. I think it didn't work, guys. So, all right. All right, you guys. I am on the other phone. Like I said, I definitely do not want this live to be interrupted. Um, so I'm going to wait for a few of you guys to come on. Kurt, come through, you guys. This is a Samsung phone too, you guys. I ain't that fond of it either. Hey, ladies, Leisha. Okay, Leisha, you're on. I do see you. I want to turn the brightness up, but I don't know how to do that. Hold on, guys. I got some stuff I need to share with you guys, and since I've been not on live, you guys know that I definitely come out and I give you guys some information, and I just fall back, especially when there's times where some of that information, people kind of take a negative approach to it. I just say I'm just gonna fall back and watch, and I've been watching from the sideline, and I've been hearing some stuff. So the first thing, and you guys let me know if you guys can see me pretty okay, because from my end it's kind of blurry. Miss Tammy dropping wisdom. Okay, so y'all give me a second. Let me see if this blurriness is from my end. Okay, I just think it's the way the pixels are. Okay, so one of the things, you guys, that I am really honored that I was able to, first of all, today, through a lot of my information that I have been getting and a lot of things that have been going on, just God always position you in the right situation. And today I was able to actually sit down and talk with Dr. Boulos personally, and just really get a take on Dr. Boulos's take on a lot of things that are going on. And I'm going to just share some of that perspective. And I say perspective, I'm not going to be quoting or unquoting, just a perspective and some of the sentiments that I share in the industry and what's going on, and then some of the things that have caused the changes that he decided to make. And I respect it. Trust me, I respect it. And he is a New Yorker just like me, and one of the things that he did say was just being straight, being transparent, being real talk, right? And those of us that are coming from that perspective are the ones that are being ridiculed, the ones that are being lashed out at. And so that was some of the stuff that he had encountered during his stay at the various clinics, just really speaking up for ethical practices and making sure that things are being done in an ethical way, a safe way, and basically being an educator and that's why I think a lot of you guys that have gone to Boulos know that he will sit down and talk with you and educate you on that. So I'm going to get back to that conversation, because that conversation kind of ties into some of the things that I wanted to talk about. But I was able to sit with a doctor and run past some of my questions and stuff, and help me get some clarity on some of the things that I had been seeing from somebody that was inside, the whole industry, Ladies, I'm going to say this, and I'm going to be very upfront. And, sometimes when you see that we make shifts and stuff, and Nisha, I can't read. I ain't got my glasses, y'all know. I make shifts at different times, and I position, and I'm doing certain things different. I'm doing it because I'm consistently seeing things happening in the need. Women, I don't care. Y'all hemos are dropping like crazy, and I don't know where it's coming from. You can give you beet juice, you can give you wheat juice, you can do whatever, right? Noni juice, Pedialyte, what is it? I don't like it. I don't use it. Gatorade, you know, all of these things. Ladies, it's going to be imperative that you guys set yourselves up for for drips, okay? Because there are so many dips and unstabilizations and things that are going on. And just remember that I had told you guys that I knew that at some point that I couldn't be the only recovery house speaking out about the things that we are seeing. And I think somebody just sent me something on a certain recovery house who is speaking out about having, at the same time, multiple of her clients ending up in the emergency room. And this is the first time that I've seen somebody decide now, you know, and they've probably been in business for a minute to decide to see that they want to speak out, and not at all am I into surgery with memory recovery. Okay, I missed that, but I'll go back down. Okay, could somebody bring me? I went into surgery with a 12 and out with the 10 something when you checked me. Yeah. Yeah. Hey, Vanity. Yes. Hey, babe. Yeah. And so, you know, we immediately will start the holistic approach to raising your hemo. But I'm seeing now that we're working with Nurse Tony, being able to get these drips in place, we are seeing that these girls are stabilizing because the fluctuation of blood pressure up and down. You know, some of the ladies, again, we did talk about the new pain shot. Also, you know, with the numbness and feeling, you know, of the numbness and things like that. And these are direct results of nerves, possible nerve damages and things that are happening during the course of the surgical procedure. And as the doctors now are in slow competition, and that's the thing, it is a competition because as the industry is advancing, you see that these doctors are being competitive with each other, and that's at the risk of us, right? You see, and doctors are doing surgeries in less than 2 hours, right? So that means that's aggressive. That means that put that person at risk, okay? That puts you at risk, you know, for nerve damage, for fast, you know, slow recovery response time, neurological delays, things of this nature. And I'm just crying out, and you guys ain't gotta take nothing I'm saying, okay? Because I just fall back and I just watch, you know. But when I get my data, I share with you guys, and I just say, listen, ladies, prepare your bodies, because some of you guys abuse your bodies for surgery, and right now they getting so aggressive. I don't know if it's in the fucking anesthesia or it's in the procedure, but something's happening. And it's causing I'm trying to stay up with the things, and it's causing more trips to the ER than normal. And so I guess I can say kudos to that person that spoke out, but making sure that, you know, we are getting numbers, and we are checking, you know, and ladies, positioning yourselves to getting those nutrients in your bloodstream as fast as possible. We're not sure whether or not you guys are getting the cell saver. They're saying it that you are. Like you said, if you don't see that IV and you don't see that blood running, this and that, you ain't got shit, okay, but beat. Okay, you ain't got nothing but beat. Okay, and beet juice ain't gonna always save you, but it definitely is a barrier to that. Okay, and ladies, y'all bear with me because this is dim on my side. If you guys are posting questions and stuff, I'm going to post a live. I will go back and try to see if I can answer, but I can't see shit. Okay, you guys, I can't. Sammy is a little blind as a bat, and then I'm messing with the dimness of it, but so I am. And so we need to make sure that we are putting ourselves in the best position ever. You know, most of the ladies now are getting, my ladies are getting post-op drips. And I know that I tell you guys this isn't for the weak and this isn't for the cheap. And when we're operating in the cheap perspective, we weaken our chances to be strengthened in our recovery process. So this is something that you guys may want to start looking into adding later on, but making sure again, because as this thing begins to progress and as the trends begin to, everybody starts to get into it, making sure you know what the hell you putting in your arm and who's giving it to you, and that you can see. As you guys see, I did post the things where Tony is letting you guys see it and explaining to you what it is, like we do when we give you your medication after surgery. We're gonna let you know what's in it, what you're taking, being informative, being trusting. Ain't nobody gonna sneak or give you shit while you sleep and then tell you you got it. You know what I'm saying? Making sure that you're invested in your whole entire recovery process. So I definitely wanted to speak out on what's next as the industry gets larger and as people begin to get into it. Things are starting to change. I don't know if the anesthesia is stronger because they want you under fast and they want to do this shit real quick, and then before you know it, you're out the goddamn door in less than 2 hours now. That's some BS. Okay, that's some BS. And definitely those that are in this industry as caregivers, be ready. Be ready. If you ain't trained, if you ain't skilled, if you don't know how to do blood pressure, you don't know how to do hemo, this and that, you need to train your staff. Y'all need to be ready for these girls because the shit done changed and it got real. Also, you guys, along with this, I'm seeing a lot of depression. Again, so let's talk about the mental health, the postpartum, post-surgical depression is, and I don't know again if it's the anesthesia or what, is it because we didn't do a lot of research that we would have to be confined or feel confined and limited to what we can do because we need to heal. I don't think that a lot of us are preparing ourselves mentally and emotionally for this journey. And because they was like, nobody, I don't know why everybody always saying when they at this point, nobody told me about this part. I did. I fucking did. I've been telling y'all since day one about all of this. Okay, so now, I try to create an environment where it's comfortable, it's soothing, because you guys feel like you guys in a cave. A lot of girls want to say, I want to play games, I want to do this. Shit, it's hard to play games and get up and move around when and your energy levels are low, and you're finding that, doing too much too fast, these girls' hemos are dropping because now they want to twerk and they want to work and they want to do all this because you got a euphoria feeling good, but you got forget that your body is still going through a healing process, and the more exertion and more stuff that you do to it, the more you're making it work, and it's already trying to work to heal. And now it's got to work to deal with all this other extra shit that you're doing, and sometimes we just have to really kind of just get to a point of educating you guys on this shit is serious. This is serious, and it's not all about the look after. It ain't cute, the recovery process, and then just what's going on with us in this industry. With what kind of anesthesia am I getting? A cell saver? Did I pick the right recovery house? Or, I should go to an Airbnb. We did the Airbnb hotel versus recovery house. I do want more recovery houses, not to be afraid to speak out about it, because you need to make sure these women are aware that there are risks and these things are actually happening, you know. And I don't think anybody is exempt from that, but people think that if they don't speak, if they, oh, okay, you know, people could look at it like, oh God, you know, I don't want to go over there because she had multiple people go to the hospital. I'm glad she took them. I'm glad she took them, because some of them wait to the last minute, you know, to take you, you know. And then there's the thing between making a decision, you know, as a caregiver to seek medical attention versus you guys saying, oh, I'm gonna call my doctor, and they say, well, they'll ask you a couple of questions and then say, you know, you sound like you all right, you know, I don't think, you know, this and that. So that what the doctor says trump what the fuck I say, right? The fact is, the doctor's not watching you. The doctor doesn't see you every day, every minute of the day that I see you, that makes me make that call. And then you'll make that call and they'll say, no, you don't. I don't think you need to. You know, based on, you know, the way you answer those questions, you're probably fine. If you trust to go where you're going to go for your care, trust the caregiver. If you don't trust the caregiver, why the hell are you there? And I don't think that at any point that I want to get into any verbal dispute with anybody versus what I say, what your doctor say. Everybody know Miss Tammy tell y'all, after surgery, don't tell me what they said. Don't tell me what they said. Because they all are saying something different. All we're going to do is what we know is consistently. I don't care if you're Asian, African, Hispanic, Caucasian, Afro-American. We've kept them all. And we show consistency. And everybody has a body, everybody bleeds. I don't care what nationality you is. You're going to go through the same process. Okay? And so at the end of the day, we watch your eating habits. We watch, you know, the way you're moving. These things are the things that make us make a decision. And I hate for somebody to say, oh, I'm going to go there, and they are going to tell me that. Give me 1 second, you guys. 1 second. Here, answer this. I think it's a spot for the patient. Okay, guys. I'm back. I knew that they were going to possibly call. Yeah, so at the end of the day, you know, I just really wanted you guys to understand that this is serious, you guys. And I've been trying to get on for a couple of days, but then today, okay, 45 minutes. Okay, and today, and then to let you guys know, because when I start seeing it, I know that there's a shift that's going on. And sometimes God prepares you right in time and say, hey, y'all need to start doing this, not knowing that it's going to be needed. But I've seen it, like I said, I keep trends and records, and I've been seeing it, and I said, hey, it's time to incorporate this, because these girls are going to need it. You know, they're going to need it. And so right now the takeaway is to add, and I think we talked about that for you guys to start to add and take a look at possibly IV hydration drips, pre and post, possibly, you know, those also that deal with anemia prior to surgery, who you know, did a lot to get their hemo up for surgery, might want to look into an infusion, you know, afterwards. Really being honest with yourself on, you know, one of the things that Dr. Boulos, and we'll get to, that's what I'm going to lead into, but Dr. Boulos talked about is, you know, the possible, he did talk about the IV drips and the B12 and things like that. But dealing with people that are dealing with anemia issues prior to surgery, ladies, you guys know who you are, and then being able to do the cell saver, especially for those that are dealing with those situations, is highly recommended. The only thing that concerns me is if in fact you guys are getting it. If you guys are getting it, and asking for your medical records afterwards, after the fact, is something that you will do to see if you got it. But what do you do in the meantime when you're questionable whether you got it or not? So maybe do an infusion or whatever, you guys. But there's got to be something more than just taking now folic acid, vitamin C, SS tonic, blood builder, all of those things. Yes, we need to continue to take those things. But I think that this industry's gotten a little bit aggressive because of the competition for the market that is now coming up and rising. And so everybody wants to be a rising star. Doctors want their name and fame, and they want their name to be called out on Instagram, and they want the Facebook chasers and stuff like that. So they are doing things for the clout that could take your ass out. Feel me? Okay. So, I'm not gonna babble because it's about dinner time. I just wanted to get on. This is just like an alert message from Miss Tammy. For those that were on, you were supposed to be on to hear the message. I will save this live. Y'all know when I look like this, I'm concerned. I'm concerned because everybody got an opinion about shit. An opinion ain't gonna save your life. So you can have an opinion about me, my techniques, my lives. But if I could save one girl, it's worth it. Y'all don't know, every day I tell y'all, every day I go home and I go to sleep and I get up and I ask myself, is this shit worth it? Is it worth it? You guys talk and stuff, but people that run houses, we give up our lives to be here for you. So I'm grateful for those that take the time to listen. I don't, people come and they listen to you, and they be on your lives, and I'm just a human, and oh, Miss Tammy, I can't wait to meet you, and I'm just meeting another person just like you. I try to keep my house very simple, very homey. So don't come looking for bells and fucking whistles and Chanel and Versace ass room. Come look for a damn bed where you're going to be taken the hell care of. And get home to your families. Because our priorities are all fucked up in the game, man. It's messed up. It's messed up. I am very thankful for you and your team. Thank you, Vanity. So it's scary, y'all. It's real scary because our daughters are getting ready to get in this. our daughters. And if we don't change the game for them, this shit is gonna be out here for a minute. It ain't going nowhere. It's like fucking COVID. You know, that shit keep changing. Keep getting a new damn strand. That's the same thing with this industry. Having a talk with Dr. Boulos today, and he was so transparent and so honest. And then found out that, you know, he shared the same sentiments as me. You know, just being upfront, honest, real talk, and he got backlash for it, as I do. And they made the decision to do it. And like you said, they defame me, they defame him, and the defamation and all that stuff, you know. But you just stay in the game, you know. And I was glad that, you know, it's going to take a village, it's going to take a team of like-minded people to continue to be out here as this journey continues in this industry, to be a vehicle and a seed for change. If nothing else, just be a platform for those that choose to use it to help, those that seek help, you know. My prayers go out to the 3 young ladies that I just read about. Somebody sent it to me that ended up in the hospital. I think that's the best place for them. You know, kind of sounds like Hemo issues to me a little bit. You know, we are our sister's keeper, yes. And I just thank my little team that's out here on Instagram, that's out here just fighting with me. You guys are wonderful. I thank you guys. Y'all know who y'all is. I ain't gonna expose y'all, but they might get y'all, they might fucking cancel y'all in them damn groups, so I ain't gonna call y'all name. Y'all ass is gonna be X-Men, but they gonna cancel y'all shit. But yeah. Am I my sister's keeper? Keep pushing, Miss Tammy. Thank you, babe. Yes, I am. And my sisters keep me too, so I ain't going, it's a two-way street. It's a two-way street. Yeah, we'll talk about Dr. Zuri tomorrow. Just really looking into, you guys, some other avenues for you guys. You guys know Dr. Bulls has always been the #1. You guys know that from me. And sitting down talking with him, definitely, it ain't about the work that he does as a plastic surgeon. It's his perception, his point of view. That's what impresses me, because he thinks like me, like this gonna be done. It can be done safely. Like he said, I'm not gonna risk your life. He said, I'd rather cancel you than do a surgery that's gonna put you at risk. But people were just, at the other place, just canceling and putting his name on it, you know. But I just really think that, you know, it's going to take more people like me. It's going to take more people like him. But at least we still got people like him and me that's still out here. And the journey continues, right, you guys? So I did talk about, I'm just going to say this and I'm going to close, that sometimes you guys got to start looking into some of these private doctors. And so I was able to take a look at Dr. Z. from jewelry plastic surgery. And he does a good job. I was impressed, with the precision instead of the incision. The precision. Okay? And no, nobody paying me. I ain't know nobody administrator. I ain't been, I ain't friends with the doctors, and I ain't gonna open no damn Facebook page, and I ain't gonna do an Instagram page and speak. Cause I don't eat with you if I might have to cut you. Cause I don't break bread with you if I might have to talk about you. So I don't be on nobody's list. Okay, because if you ain't right, I'm going to talk about you. So, don't do me no favors, because I don't want you mad at me later. Let's just respect the game. Let's just respect each other. So, again, I'm not on Dr. Zuri's list. I don't even, half the motherfuckers don't even know who the hell I am. But I just like to give you guys avenues to God, it was just funny because sometimes God, subliminally things happen, the universe, energy, for y'all don't believe in all of that shit, I do. But 2 years ago when I first started, I wanted to do a consultation, but I could never get there. See, God got his time. It wasn't time for me to get there. God wanted to get these damn eye bags done and shit, and wanted to possibly look into, some shit I could do with my face. And I was looking through Google and shit, and Miami and all this, and then I happened to see that page, and I looked through a lot of, for some reason that caught my attention. So I would set up a consultation, but shit, by the time it was time for me to go, I had to go pick up a patient, so I never made it. So this been 2 years going, and they probably got my name down there and be like, this motherfucker don't ever show up. But I happened to show up for somebody that had surgery there, and God know what he's doing, because we need other avenues. We need to try to fall back out of the vicious cycle of the clinic versus the clinic type shit, and the competition and all of this here. And they are actually similar to New Face, where Dr. Boulos is kind of doing that type of work, facials and reconstructive and different things like that. So they are multi-skilled in a lot of other areas. And they doctors, and as Dr. Boulos says. So you guys check Zuri Plastic Surgery out. I'm still researching, but I did see something good. Bedside Manner was pretty good. And New Face, New Face. And then I was telling Dr. Boulos again, I was like, hey, because I wasn't sure where he was, and I wasn't sure it was what the place that I thought it was, because way back, and I don't know if it was Dr. DeLeon or whatever, but the doctor came from Miami Surgical Center. She quit, and she ended up going out there, and she ended up having to come to the house to see the patient, and then we ended up taking the patient there. And that's what I'm saying, like, sometimes don't forget shit that you cross, because you never know when you have to cross it again. That's why people say don't burn your bridges, because you never know when you have to cross them again. But these two specific places, New Face and Zuri, have been some place that I have crossed in the past, and now I'm on a platform to say, hey, I remember y'all, but I didn't know where they was going to play at point in my journey. So everything that you go through, God takes you through a journey in life, right? And there are things that you're going to pass along the way, and you might take notice of, and then you might even say, right? But never know how that's going to play a part in your journey, because he made you stop and take a look at it. And you looked at it, and okay. And that was your introduction to something that was going to come somewhere down the line that was going to probably be beneficial for you. Okay? And so you guys just really be mindful of the journey that you're taking and things that you see, because we always talk about when that gut, that thing that we bring life into the world, starts talking to you, it not only does it bring life, but it saves your life. Okay? So continue to try to operate from my gut or my instinct or that something. That's that silent detector that is built within. Okay? So As I always like to say, am I my sister's keeper? Yes, I am. Miss Tammy, always remember, this isn't for the weak and this isn't for the cheap. Ladies, thanks for joining me. Until next time, I ain't gonna promise y'all tomorrow. Alicia said we'll talk about Dr. Zuri tomorrow. She trying to get me on tomorrow. But I get on when I can, you guys. Love you guys. Take care.